I'm Robert Sandler. I'm professor of medicine and epidemiology at the University of North Carolina at Chapel Hill, where I'm also chief of the Division of Gastroenterology and Hepatology. If your patients are like my patients, they'll ask you what they can do to lower their risk of getting colon cancer. There's a lot of information on the popular press and on the internet, much of which is misleading or frankly wrong. And what I'd like to do in the next 5 minutes is to share with you some simple, practical, evidence-based guidelines that you can share with their patients that will lower their risk for getting colon cancer. First of all, why do we think that colon cancer could be prevented? We've known for some time that when people migrate from a low-incidence area, such as Southeast Asia, to a high-risk country such as the United States, the risk of disease goes down within 1 generation. And what that means is that there's something in the environment that's responsible. And if we could figure out what it was in the environment, we could prevent perhaps 70% of colorectal cancer. Understandably, there's been a lot of study of diet and lifestyle, and that's the information that I'd like to review with you today. Historically, the first exposure that was looked at was red meat. There are a lot of studies that have looked at red meat and processed meat, and they've shown that people that consume these more frequently are more likely to get colon cancer. The reason may be that when we cook meat at high temperature, we generate heterocyclic amines and polyaromatic hydrocarbons that are carcinogenic. Most people think that fiber lowers their risk for getting colon cancer. The hypothesis is popular and it's appealing, and it's probably not correct. Current evidence suggests that fiber probably does not lower the risk of getting colon cancer. Just because fiber is not protective does not mean that foods that contain fiber might not be beneficial. In addition to fiber, fruits and vegetables contain hundreds of phytochemicals that have been shown by natural product chemists to be anti-carcinogenic and anti-mutagenic. The problem with fiber containing foods like fruits and vegetables is that currently we don't have enough evidence to strongly recommend that people eat them. There's a lot of epidemiologic evidence to suggest that eating more calcium lowers the risk for colon cancer. In addition, there is a large randomized trial that demonstrates that calcium supplements can lower the risk of getting colorectal adenomas. Vitamin D is intriguing, but currently we don't have enough information on vitamin D to recommend it. There are a number of epidemiologic studies that have shown that folate in the diet can lower the risk of getting colon cancer, and there are 2 large randomized trials. Unfortunately, those trials showed that folate supplements did not lower the risk of getting recurrent colorectal adenomas. So folate in the diet is protective, but folic acid supplements are not. Obesity is a risk factor for colon cancer, particularly abdominal obesity, the kind of obesity that is more common in men. And physical activity has been shown to be protective in a large number of studies. Cigarette smoking is a risk factor for colon cancer, and alcohol is also a risk factor. So based on all that, what can we recommend to our patients? I have 6 recommendations. First, decrease the intake of red meat and processed meat and increase intake of fruits and vegetables. Secondly, consider a supplement with calcium carbonate 1,200 milligrams a day. Third, avoid obesity. 4, engage in regular physical activity, perhaps 30 minutes a day. And 5, don't smoke and limit alcohol. Now, because most of your patients won't do those, my 6th recommendation is to get a screening colonoscopy. Thank you.